You're all right, Jed. You're not going to fall off. You feel like you do, but I promise you're not.
17-year-old Jed Dawson was on his way home when he came off his scooter.
He's had the maximum amount of painkiller that I can give him. Put your arm back up there, fella.
Technician Paul Smith has begun Jed's treatment.
He's got a serious left leg injury. He's snapped his femur. We've had to bring it back into its normal position to give him some pain relief.
Junior doctor Amir Khan is waiting with Registrar Peter Williams for Jed's arrival.
4 to 5 minutes, I think.
Yeah, we need to get IV access into him, get blood sent off, and make sure he's got fluids up and running, and really just lend a helping hand to Pete, who'll be leading this trauma.
You're going to get lying in and get some bloods off. Okay. If you could also give him some pain relief if we think it's necessary.
What's going to happen now is we're going to get in the LZ right, and it's going to be people everywhere. Right. All we want you to do is relax as much as you can.
Jed is fully conscious and in shock.
This young man's Jed, he's on a scooter going about 25 miles an hour. Left leg was turned to the opposite direction.
Lovely. Okay. Any pains in your chest? Any problems with your breathing? What's his pulse and BP? Okay. Is that sore there? What about if we do that? Okay.
Just getting a line into him now. I'm just going to send off some bloods. Sharp scratch.
How's the pain at the moment? Out of 10? About a 7 at the moment. Okay, we'll try and get it down to around about 3 or 4. That's great. So I'm just going to give you some painkiller now. Okay. Might make you go a bit dizzy and a bit sick. From a kind of overall point of view of his airway, breathing and circulation, that seems okay again. Obviously it's dead scary and you look very scared, but don't worry. Okay. It's going to be fine.
Peter reassures Jed and keeps him informed about his condition.
You're all right, you're all right. You're not going to fall.
I'm just checking for cervical spine tenderness to check whether there's any possibility that his neck's been broken or anywhere down his spine, really. So what we're doing now is just log rolling in, keeping his spine absolutely as straight as we can possibly get it while he does that.
Any pain down there at all? Does that feel okay? All right, and you can feel me touching you.
Doesn't look like there's any evidence of spinal tenderness, which is good.
Do you want him collared and strapped?
Collared and strapped, yeah. Just going to x-ray his neck just to make sure that's all okay as well. All right.
Jed's leg took the full force of the collision.
Right, just putting your trousers off now, Jed. Can you feel me touching you there, Jed? Feel normal? Just going to feel for the pulse. Pretty much under control. Yeah, looks fine.
Won't lose it, will I?
But obviously we need to keep an eye on it, make sure everything's okay. But I'll be very, very surprised indeed if there's any chance that you lose your leg. Okay.
Very lucky, very, very. All I remember is a car pulling out and that was it then.
Double dump, mate.
This Gerard's x-ray back, and anybody can see that that bone's clearly broken. What should be a nice straight up and down bone is actually bent in the middle. We're just going to just very gently pull on your leg, and then we'll put it in a special kind of a splint, which helps to just hold the ends of the bone in the right position.
Be careful.
I'm going to be dead careful. All right. Just putting a bit, some manual traction on the leg now by pulling it. Come on. Just get that right up. Just going if you can. Just going to lift your leg up, Jed. Okay, that should be fine. That should be fine, I think. This is the last bit of the splint application. I'm using this quite sophisticated piece of orthopaedic equipment, which is 2 lolly sticks. Right.
Peter calls in Jed's mother while he looks at the neck x-rays.
I can't see any shift. Luckily, looking at your neck, everything looks fine, so we're going to take these off. Because you've been lying down for so long, you might feel a bit dizzy when we sit you up. You all right?
Jed is taken to theatre to have a metal pin inserted in his leg. At 28, Mike Windever is one of the youngest paramedics in the service.
Some people are very messy, don't lift a finger at all, so I think I've got obsessive compulsive disorder. Everything's got to be clean. My wife will tell you that.
Today, Mike is working on one of 15 ambulances that serve central Liverpool. The driver is technician Neil Cartwright.
Yeah, just after the TA barracks here, the lights.
I've been called to an address. A 13-year-old child's been bitten by 3 dogs, apparently. So go and have a look. Cheers, dude.
Started wagging my legs and my arms.
Okay, so there's 3 dogs.
Yeah, 3 bullmasters.
Right, so nasty ones as well. Just take this off a minute. Some clean bits. This is young Joe. He's been on the footy pitch and...
No, it's just walking across.
Oh, right, he's been walking across and 3 dogs have gone to town on him. Obviously stinging a bit, yeah?
Yeah,
Normally 1 dog's enough, but when you've got 2 or 3 at the same time, it can be nasty.
yeah.
Okay. They're just little puncture wounds where the dogs have obviously just sunk their teeth into you and they don't let go, dogs like that. So it's got a good pulse, so I'm sure that we wouldn't have lost too much blood.
No,
But
I don't think he has.
No.
Back straight away as well, so...
My arm's going numb.
It's all right.
Can you feel me touching you?
Yeah.
Yeah.
That's all
Okay.
It's just...
Wiggle your fingers for me, Joe. Good lad. Don't worry, mate. See if we can get you a new leg, and a new arm. Come on, best step. See if you can lift that leg.
No.
13-year-old Joe Schofield was walking to his sister's when he was attacked.
Okay, sunshine. Have a seat on the right for us, mister.
Oh yeah, look. Yeah, on the side, mate. Scratches.
Yeah. Go on. Sit yourself down, Joe.
It's because they started chewing my shoes and just like...
Just playing initially.
Yeah, and they just went mad and just started biting me.
It's enough to traumatise you for life, isn't it?
You'll be able to tell everyone the shark bites, mate. Right. Try a little bit of gas. Just to help you with the pain in your shoulder. He's very, very, very lucky little boy. 3 dogs the size of that they are, normally it's about 10 stone a pop, dogs like that. To take him to the ground and have a chew on him, he's very lucky they haven't hit anything.
Joe is taken to Alder Hey Children's Hospital.
See how performance can begin.
Dr. Peter Williams has worked in emergency medicine for 4 years.
Pretty much from when I did my GCSEs, I knew that what I wanted to do, and that was to do medicine. I was actually inspired by Clive, who's the doctor on Neighbours. He was like GP, cardiothoracic surgeon, neurologist, but ER was where I wanted to do A&E, which is just ridiculous. I'm Peter, one of the doctors here.
54-year-old John Hughes damaged his hand working on a building site.
It's not as bad as it was yesterday. Like
Good.
It's,
When did you do it?
yesterday morning.
Okay, and how did it happen?
It was when they were stripping the scaffold on the outside of the building. The scaffold and tube dropped.
Okay, so
Pure accident.
I bet there was a few
It danced a bit like.
a few oaths.
Well, there was a lot
came
more
out.
than that,
Yeah.
like, but
Okay. And you've already been sent for an X-ray, haven't you?
I've had all that, yeah.
I'll have a little look at the X-ray now then. We can see on the X-ray that this is the middle finger here. And at the very tip of the finger, there is the bones of almost burst apart. This wound shouldn't need any treatment. The bones will heal on their own, which is great.
As soon as the pressure gets alleviated from there, I'll be fine. Well, I think I will, because it's not really a bad place. It's only at the top there.
Okay, what I'm going to do is just going to make a small hole in the nail, but because it's just the nail, you won't feel that. Okay, and this is just something, a piece of wire that heats up very hot, and it's just going to make a very quick hole through the nail. There we go. How's that feel?
Great. Marvellous. Feels as though I've got a lot of excess skin there now.
So all that blood that was collected underneath the nail has now been released, and that lets all that pressure out. Excellent. Just lift your finger up for us. Let's give it a wipe round. Oh, sorry. Sorry.
Big baby arm.
No, not at all. I'm going to give you a short course of antibiotics, just because I've made a hole in the top of the finger and there's a broken bone there.
Thank you.
All right.
Mike and Neil have been called to a patient in South Liverpool.
We're off to a 92-year-old female. She's got back pain. Do you want to just sit down there, Hilda? You all right?
Hilda Kirkham has injured her back.
Put your feet up.
And I was so frightened, I didn't know what to do.
Oh, Hilda, don't worry, eh? Don't worry. Let's have a little feel of your back. Do you feel like your muscles all tense?
Yeah.
Your back?
I don't know how they feel.
Oh, right, just right there.
Yeah, just there.
Okay. I think Hilda's probably just twisted the wrong way and possibly just pulled a muscle in her back. So every little step's going to hurt even more so.
On the bed to help me to get up.
We'll get you a little chair, all right? We'll take you out to the ambulance. Okay.
I'm sorry to bother.
Not at all. No bother.
I'll take a couple of painkillers.
No bother at all.
No.
She tries to be as independent as she can, but this has knocked her off her feet. Don't put your coat on. I know. We'll bring it with us.
About 20 years old.
Ah.
I'm clothes mad.
Introduce me to a female who isn't clothes mad. Shall we sit down? Let's get your puff back. That's it. Okay. We can't leave her here on her own to try and battle on, no matter how tough she is. We'll take her up to hospital. Give her something to relax the muscles in her back, and hopefully she'll be out in a couple of hours.
Did he get his bloods done in number 1?
Ali Danvers is the sister on duty.
Have a seat in here for me and have a look at that.
16-year-old Elizabeth Larson has trapped her finger in a living room door.
How did you manage to shut the door on it?
I was going to walk into the room and my friend shut it.
Your friend shut it? You still friends?
Yeah.
Have you seen it?
I haven't.
No, you don't want to look? Okay. All right. Did the ambulance crew put their stressing on, yeah?
Yeah.
Okay.
The tip of her finger has been cut off.
All right.
It's been brought in case it can be reattached.
We're just turning around to like turn some music off next to me, just see Libby just go like that. She fell on the floor. It was just, I've never been so scared. She's my best mate and I've never been so scared.
Can you feel me touching all the way down here?
No.
Pardon? I can't. You can't. Okay, can you bend it for me? All right, that's good. And straighten it. Okay, what about when I touch this side?
Yeah.
That's painful. Okay. This is just some cold water that I'm going to clean it with, all right? All right, sweetheart. Okay. Nice and big, so it won't fit over. Oh, I'm sorry. She's complaining that she can't quite feel one side of her finger, so I'm just going to get it x-rayed, make sure there's no bony involvement.
I do business studies on Monday.
Ah, that's why you've done it. Do you want to do that? Get out of that, is it? Sorry, sweetheart. Could have done something a little less drastic, couldn't you, really? Is that the hand you write with?
Yeah.
Is there any bony involvement?
Yeah, she's lost a little bit of a bone as well, hasn't she?
Just there.
Elizabeth's finger needs surgery to try to reattach the tip.
You gonna be okay?
Thank you.
I like the variety that accident emergency gives us. I think I find it hard to go back to ward now where it's a bit more routine. You just never know what's going to happen in this department.
We just got a call to a female who's 36 weeks pregnant and bleeding.
Paul and Steve have picked up a red call.
In the worst case scenario, the baby could be coming away from her. On the other hand, she could be just about ready to have it. Yeah, wait till it comes in. Hello.
Anna van Kampen from Holland is 8 months pregnant and is going into early labour.
She's in quite a bit of pain, so he's giving her some Entonox, some gas and air. Just take the pain away a little bit.
Anna,
darling, the more the pain comes, the more you suck that in. You really can't do much in there. We're getting the back of it. Let's have a proper look at it then. It's a bit easier.
Anna, just take that in your other hand here. There you go.
Alright, you need to keep breathing that in, love.
How's that?
Need to go, Steve?
Yeah, ready when you are, mate. Anna, I need to do your blood pressure, darling.
Anna needs to be rushed to hospital.
Anything you feel you need to do, you just do it. Don't worry about a thing, but you need to suck on that for me.
This doesn't do fuck all.
It does. Believe me, it does.
I need an epidural.
Just a little bit concerned with the show of blood. It's been a continuous trickle all day. Slow down a bit. She's basically she's giving birth. She's getting these episodes like every minute now. You know what I mean? You've clogged me to death. Don't be. You're okay. Is that your husband? You better be quick then before you get another one of these contractions. Was it just
I'm in the ambulance. I'm having a baby,
Sorry.
Stephen. You have to come to the women's. Your mum is with me. You have to. I'll give you my mom. Your mum. Yes, Stephen. What's your Stephen? Stephen is on the phone.
Hello? She's in the ambulance having a baby.
Oh!
Okay. Nice deep breaths now. Come on. That's good. Anna, we're at the hospital now, darling. Okay, mate.
She's admitted to Liverpool's Women's Hospital.
We'll be taking her up to the delivery suite, give her a hand over there, and obviously the hospital will take over from us then. That's it, love. Hi, love. Well, she's been bleeding, apparently, her mate said, from like 4 o'clock this afternoon, slow trickle of blood. I haven't actually seen any blood myself, but there is a clear fluid discharging.
Is this your first baby? Yeah?
I want an epidural.
Alright, well we'll have to see what you're up to first, okay?
You take care, darling.
If we get a chance today, we'll come in and see you.
Take care.
Cheers,
Okay.
thanks.
Anna, look, come away from the edge of the bed, okay? You're pushing, we're going to deliver, aren't we?
Paul and Steve have got Anna to hospital just in time.
As they say, no two births is exactly the same, and that's just proved it, hasn't it? I mean, there's us thinking it worse because she's 37 weeks pregnant and she's bleeding. She's been bleeding most of the day. But, speaking to the midwife there, birth's imminent.
Little Louise. Yeah. It's amazing. I'm still in shock. Oh, look at that. And I did it all without drugs. I was too late for it.
Mike and Neil are dealing with a familiar face.
Let's get you up. Lovely. Should we stick the kettle on?
Yeah.
How'd you have your tea, Hilda? Do you want a cup of tea? I'm not making you dinner, go away, will you? Nice and strong.
No, just ordinary.
Just ordinary. My tea isn't ordinary, I tell you. Doesn't do any harm. Leaves you with a smile on her face. There you are, missus. Right, we'll leave you to it.
You've enjoyed the shopping.
It's been fun. Get your cuppa down, yeah? And we'll leave you to it. I'll switch your dog on for you.
Yeah.
No wonder she can't sleep of a night. Don't think I can. Good night, Hilda. Good night, love.
The Royals serve central Liverpool, and tonight, like most nights, it's busy in town.
He's in Majors.
Dr. Mark Buchanan is on duty in Miners.
Cheers, bye. Right, can you feel me there, sweetheart? Yeah. What I want you to do is wiggle your toes.
19-year-old Nicola Rowlands has cut her foot while on a night out with friends.
So was it a good night before this?
Yeah, quite good. Do you know who it was who smashed the bottle on you? It was that lad that you were talking to. We were waiting for our taxi home and someone bashed into us and dropped a glass bottle on her foot.
There's certainly a bit of clot under there. Sorry, honey.
Is this going to be stitches? Yeah. Is it like butterfly stitches or actual stitches?
Proper stitches.
Oh my god.
Do you want me to sit next to you?
Lift your foot up, sweetheart.
I am a bit scared.
Don't be scared. You'll be absolutely fine, I promise you. It won't hurt me at all.
No, me.
So what I'm going to do is I'm going to put a little bit of local anaesthetic in. This is going to sting a little bit, but don't worry. You might be able to feel this, but I just need to look at it. Okay? Are you all right?
Does it hurt? Can you feel it?
It's important to make sure it's clean to reduce the chance of infection. This is quite a clean wound anyway, so I wouldn't expect any problems with this. There's going to be 4 stitches to remove. So we'll just get a nice dressing and then we'll get you on your way. You'll be able to go home. Is that all right?
Okay, yeah.
Any questions at all?
Leave a scar.
Do you model your feet?
No.
Should be okay then. Where's your coat?
I didn't bring one.
It's -4 out there. Would it not be fashionable to wear something that was warm and...
No.
It's still a good night though, isn't it now?
Yeah, it really is still good. We will be putting...
Mark and Peter have a surprise in store for an important colleague.
This is a Valentine's card for Bridie, who's never had a Valentine's card in her life.
Bridie is the tea lady and is an absolute star.
She's more used to us than all our consultants put together.
Ambulance crew Paul and Steve have been called by the police to a violent incident.
Yeah, we've got a 30-year-old male's been assaulted in Pembroke Place outside Domino's Pizza. All right, fella. Looking at that right away, right now, you're going to need stitch in that. So we need to have a look here on the ambulance.
Mohammed Araz has been hit in the face.
What you need in that is to close it up. You've got a massive gash in your lip.
Every time you talk, it opens it, okay?
I say, why you not giving No, wait a minute, Mohammed. We'll get the police to deal with that, sort it out for you, okay?
Sorry about this, mate. Really shouldn't really be talking that much with that, mate. It's quite a nasty cut. And you keep that there like that, okay?
Okay. There's been some kind of altercation.
I don't know. He's in the back, coming into my face.
We need you to stop speaking, okay? You've got a big gash there. We need to sort you out at the hospital. There you go. Just keep hold of that.
Ready to go?
Yeah, ready when you are. If it's clean like that, it's a weapon. It's got to be glass, something sharp, hasn't it? You know, a knife, a bottle, anything that's sharp like that.
What time are you on till?
Yeah, right. He's Raki Mohammed. I haven't got anything to say.
Hi, Mohammed.
He's been smacked in the face. I don't know where. It looks like it's some kind of like he's got a laceration from the. Well, you can see it.
All right, my friend. Let me get some gloves on. Sorry about this, my friend. It's not very fair, is it? You've certainly lost one of your teeth. This one's been pushed backwards. You've got a small cut on the lower lip, but this one's quite impressive. With that removal of your tooth, you might have actually broke some of the bone within that as well. So I think the first thing we need to get is an X-ray, okay? On first sort of glance, it looks a nasty laceration. This is the kind of thing that may have to be referred over to the maxillofacial people, which is in a different hospital. I've got one in the same place, really. It's just under there when I got eaten by an Alsatian when I was only little.
Have you a good friend in this country?
Yeah, I have.
In Liverpool?
Yeah.
There's certainly no major fracture. There's nothing that worrying on that X-ray. The first thing is for me to speak to the maxillofacial people. Yeah, hi. Could you beat the Matsfax doctor for me, please? Yeah. The vermilion border I like to think of is sort of the lipstick line where you would go up to, not me personally because I don't wear lipstick. it's basically gone through that line, so it's important to make sure that it's brought together well from an aesthetic point of view. Thanks very much, mate. You're a star. Cheers, mate. Bye.
Mark refers him to the specialist facial clinic to have his lips stitched.
Right, okay. I mean, ultimately, one of the best things about you going over to Fazakli is that, although that will get closed, but the other thing is they can look at your teeth and have a look and sort them out for you as well. We'll just put a little steri-strip over there, so just a sort of a temporary thing, really. This will come together quite nicely. There will be a scar there, but I'm sure that will fade with time. I've had a really good weekend. I've got some good people I've been working with, and that makes it all worthwhile. But I just can't wait to get home and crawl into bed and fall asleep. Might even have a little glass of whiskey.
It's also the end of the shift for Peter, who has one last job before he goes home.
She's disappeared. Gotta be the kitchen. Doing the place. Nothing.
Oh. Oh,
You have to open it.
Of course I'll have to. Seems the first one I've ever had.
Of course not. We better watch out in case she gets overcome by emotion and collapses or something.
Oh, I'm gonna cry.
Well, I couldn't. I thought, what's the world coming to if you've never had a Valentine's card, Bridie? So you can go home and put on the mantelpiece.
Thank you.
Jed had an 18-inch pin inserted in his leg. He spent 7 days in hospital and 3 months on crutches. Surgeons were unable to reattach the tip of Elizabeth's finger, but it has healed well. And Mohammed's lip needed 8 stitches, leaving only a slight scar.
Stay with us here on 3, as next we have another offering of Trauma Uncut. You could say it was a second opinion, but that would be silly.